Daddy, without a doubt, it was a healer. And at a young age, my dad was truly interested, I think, in medicine. His brother and he were out on a little trip, and my dad got bitten by a snake. It was a rattlesnake. And so my uncle put him on the back of his bicycle and rode him into town to the country doctor. And that relationship with that country doctor started his whole background, I think, in medicine.
Dr. Brown was a real visionary as it related to rehabilitation. Years ago, there was not as much of an understanding of the value and importance of rehabilitation. He, as a surgeon, really could understand. He would operate on someone, and then that recovery period afterward, how important that was.
We take some of the most complicated patients, period. Other standalones do not take these individuals, but we strive to do what we have to do to meet the need.
This whole idea that people would need care to get better, that they were being pushed out of hospitals early, and that they would need an in-between space between the hospital and home was a brilliant idea. He believed that every human being was precious in God's eyes and deserved to be loved and cared for and healed and taken care of. And I think that's the genesis of the rehab centers, is that people should never be left alone when they're wounded or trying to get better after a surgery. They need to be well taken care of.
As soon as you walked in the room, you felt comfortable with him. You felt comfortable that he was going to be someone you could walk right up to and talk to. Not everybody's like that. In fact, few people are like that.
I'm so blessed to have worked with him, and I've never met anybody like him in my whole life. He was a healthcare visionary, but he was such an intellectual person. And to be able to be with him and to listen to what he said was instrumental in my life. I never admired anyone that I worked for or with as much as I did Dr. Brown.
You have to take risk, and that was another big thing I learned from Dr. Brown, that you can't be complacent, you can't be satisfied with your success. You really have to be proactive in investing in new things. And that may be new businesses, it may be new technology, it may be research, it may be new treatments and protocols, but that is very, very important, and we try to embrace that.
What's been great about building and enhancing the relationship between Brooks Rehabilitation and Jacksonville University is that we share so many common interests about better health care. They're the best in the country at what they do, and they informed a great deal of what we here at the university later decided to teach.
He wasn't afraid to bring together great minds that thought differently from him. He understood that it takes a village to really envision the future. I mean, for a man who was so well educated and so successful in his own right, he was always interested and always listening to the opinions of others.
Helen played such an important role in Dr. Brown's success. I don't think we can ever think about Dr. Brown and everything he contributed to our community without also giving a lot of thanks and feeling much gratitude towards Helen for everything that she also contributed.
Both of them always saw the good in people. And if we could just all be a little bit better that way, it would make us all such a better society. It's looking for the positive, looking for the good in people, and I attribute that to them.
He encompassed everything that was good about everything, and Helen was his right-hand woman. They made wise choices together. They cared about people. As I said, unfortunately, I didn't get to know them nearly as well as I would have liked to. 20 years isn't long enough to know Dr. Brown.
It's remarkable to me how much of Dr. Brown's personal interests, leanings, emphasis, priority plays out today. I mean, he was such a remarkable leader. He had such strong feelings of how to help the community. The poets talk about length and shadow of a man. I mean, if ever there was a person whose length and shadow is being played out in this community, it's Dr. Brown.
The ability to keep his vision and his spirit alive here is what we want to do. As we look to the future, we have a lot of opportunity to grow our services, to improve our care, to get better outcomes. We want to continue to grow. We want to continue to help more people. That's important for us.
And of course, I'm very pleased at the success, as a coach would be, with the success of his football team, with basketball team. But even more than that, I'm pleased with the service it gives to society, to this community, because it has played a very large part in the health of the community. And our mission is to make this community a healthier place. And our vision is to work with others in order to do that.